Today we're going to talk about preventing contagious diseases for our small ruminant producers. So what has COVID-19 taught us? It's taught us several things, like how easily diseases can be spread. Morbidity and mortality. Morbidity is how many, in our cases, animals within a group catch a disease. And mortality is how many of them will actually die from the disease. We've learned dangers of commingling and sanitation and cleaning protocols. But what does this mean for our animals? So there have been no reports or any reason to believe that small ruminants can get the coronavirus we're dealing with right now. But there are a lot of other contagious diseases. All farms should have a biosecurity plan or practices for their farms that will prevent diseases from entering the herd or prevent spreading once it is present. So how can we prevent outbreaks in our animals? And what would the cost be if we did have an outbreak? What if a disease killed 10% of your animals? How would that affect your bottom line when you went to sell them? With various bills coming in, that can have a major impact on profits. Or what if 20% of them catch the disease? Even if they don't die from it, are they going to have lower weaning weights? These are all things that we kind of need to start thinking about. So what are some of these diseases that I'm talking about? In small ruminants, there's probably 100 diseases that can be transmitted from animal to animal in some form or fashion. A lot of them can even be transmitted from animals to people. Here's a very short list that in no way includes all of them, but just some examples. Scrapie, sore mouth, foot rot, CAE, CLs, listeria, respiratory viruses, several reproductive diseases, mastitis, and even parasites. Well, what can we do to prevent it, right? This is the big thing. An ounce of prevention is worth a pound of cure, right? Let's talk about supporting the animal's immune system. Have optimal nutrition, especially minerals, decreasing the stress. If we can genetically breed an animal that's resistant to a disease, and of course that's great. Vaccinations. For diseases where vaccinations are available, let's vaccinate our herd. Form a biosecurity plan, right? Let's think about it ahead of time. Where are our biggest risks, right? And what can we do to decrease those risks? Make sure that everyone on the farm follows those practices. If one person is being super careful and someone else is not following the procedures at all, it completely undermines your plan. Surveillance and testing. We've heard about these asymptomatic carriers, right? So if we can test and figure out who those are and remove them, we're promoting the health of all animals. Sanitation and cleaning. What can we do to our pens and our facilities and our equipment? And then lastly, the flow of movement. First, not every plan is going to be the same. Every farm has different risk factors, and we've got to be practical about our approach. What are the risk factors on your farm? It may be different than on your neighbor's farm. Identify areas of transmission, right? What are our biggest concerns? Establish clean areas versus dirty areas. Set up a quarantine where animals can be placed when they first arrive. Vaccination protocols, testing for certain diseases, and then, like I said, make sure that all workers and visitors adhere to the same guidelines. So as I start talking about preventing diseases, we need to talk a little bit about how diseases are transmitted. Some things are transmitted by direct contact, where one animal physically touches another animal. Ingestion or oral. Most commonly, this comes from ingesting feces. Aerosol transmission / moisture droplets, vectors, which are like flies or ticks, or fomites, which is your equipment like hoof trimmers. There are also some ways that reproductive diseases differ and may transmit diseases as well. So let's talk about aerosol transmission. Think of an animal's breath as being a can of spray paint. We've all heard the 6-foot rule. 6 feet could be more if you're outside in the wind and you spray a can of spray paint. Depending on the conditions, it may go further than 6 feet. So these are all things that we need to think about. Most commonly, respiratory viruses will transmit through these means. The flu or any kind of irritation will actually make the mucus in our airways thinner. That way, when we take a breath and breathe out, that mucus and those little tiny moisture droplets will travel further the thinner they are. When we start talking about aerosol transmission, we need to have a good distance between two animals. Direct contact, all right, these are things that, like I said, transfer directly from one animal to another. Some examples of this are sore mouth or ringworm. Both of those are actually contagious to humans as well. So if you touch a lamb or a kid with sore mouth, you can get some really nasty sores on your own skin if you don't wash your hands immediately. Ingestion is orally consuming the infectious stage of a pathogen. Most commonly, this is fecal oral. Even parasites are transmitted this way, but also coccidia. Leptospirosis is a reproductive disease usually, but it can actually come from ingesting urine. Listeria can have a fecal oral transmission. So ways to prevent this, let's think about cleaning water troughs, feed troughs, elevating hay feeders, especially with goats. They just seem to love to jump into feed troughs. And if you get any feces in the feed troughs or water troughs, that will transmit several diseases to other livestock. So cleaning those regularly. And like I said, eating hay off the ground. If we can get that in a feeder that's up off the ground, we're going to decrease the chance of any manure contaminating it. Vectors and fomites are a couple of fancy terms, but a vector is any living thing that may transmit a disease. Commonly, we're talking about flies here or ticks. So if we can decrease the number of flies on our animals, then that can help prevent some of these diseases. So equipment that may be shared in our dairy operations, milking machines, right, need to be cleaned thoroughly. Hoof trimmers, you can have an asymptomatic carrier and trim their feet. And if you get that bacteria onto your hoof trimmers, you can transmit it to every other animal that you're doing. Halters for show animals, buckets, clipper blades, any piece of equipment. So reproductive diseases, there are some that can be transmitted sexually. So if your buck or ram has the disease, every time he breeds a female, he may be passing it on. Some are actually transmitted by aerosol, but the symptoms end up being reproductive diseases. But then transplacental or transmammary, right? So these are cases where if the mother has the disease, it can pass through the placenta and the fetus be born with it. Or transmammary, that means the disease is in the colostrum or the milk. When the lamb or kid is born, usually in colostrum or in milk, they may be ingesting and getting infected through that means. Of our reproductive diseases, toxoplasmosis, chlamydia, brucellosis, a lot of these are going to be zoonotic as well, which means that we're at risk. The most common transmammary we think about is CAE in some of our dairy goat herds. Biosecurity plan should be practical, and it needs to be based on your farm's individual risk factors. Right? How often do you buy new animals? How many sources do you buy these new animals from? Do you show animals? How many people visit your farm, or how many times do you visit other people's farms? Do you share equipment or vehicles between multiple locations? And have you had a history of certain diseases on your farm? These are all things we need to be thinking about. So an open versus a closed herd, if you're a breeding operation, you'll usually have to at least bring in a new buck at some point, or ram. This is one thing that poses a risk. If you've never had a problem with something and you bring in an animal that does have it, you can get massive outbreaks. Are your animals raised in confinement versus pasture? When we confine animals and we're raising large groups in small areas, the animals are just in closer proximity to each other, right? There's going to be more manure in that one area. So that may be the issue that you want to focus on more. Visitors to your farm, whether it just be, a friend that wants to come look at your goats, or someone who wants to come buy your sheep, or if you have any kind of agritourism, that can pose a large risk. And sometimes something we can't control are the farms surrounding us. Do you have a neighbor that doesn't vaccinate or doesn't control, any flies on their farm? How many wildlife travel through your farm on a daily basis? Do you have a large deer population that could be transmitting diseases to your livestock? So the most strict of strict protocols is referred to as shower in and shower out. This is really commonly done when you get into the really large poultry and swine operations, right? When you show up, you take a shower, take all your clothes off, and then you put on their clothes before you can even enter a facility. And then even after you've been in that facility, you have to take a shower before you can move to another barn. For most of small farms, that's probably overkill. And like I said, not very practical. But some things that we can do. If you can limit visitors, or if you do have visitors, have them wear disposable boot covers. How we clean our facilities, how we remove manure and disinfect our equipment. These are all little things that can be done. So, limiting where you buy animals from and how many new animals will also decrease the risk of bringing in diseases. You also have to remember, limit the items you carry. If you have a cell phone or a watch, your keys that are always on you, leave it in the truck if you can. If you touch an animal with sore mouth and then you grab your phone, and even if you wash your hands, did you leave that pathogen on your phone? Things like watches and cell phones, you can't just dip in a tub of bleach. So if at all possible, just leave them in the vehicle before you enter the farm. Clothing, I talked about the most strict protocols of having to wear their clothes and take a shower. Remember your boots. When I was in practice and I had looked at sick people's animals all day, I was religious about changing my clothes before I went to look at my own animals, because I knew the animals I had been around all day were sick. So it doubled my laundry load, but I didn't want to wear those dirty coveralls onto my farm. Then let's talk for a minute about buying new animals. At some point, we do need to buy new animals. If you're in a breeding operation, you need a new buck or ram occasionally. If there's a reliable source that you can count on, that's definitely the best, or just one farm that you're going to buy from. But occasionally we need to get different genetics, so that's not always possible. And it's absolutely okay to ask the seller the status of their herd on different diseases, because whatever they have on their farm, you may be bringing into yours. Have their animals been tested or vaccinated? When you bring those animals onto your farm, we want to adhere to a strict 14-day quarantine. Remember, when you buy from someone, you're exposing your animals to everyone that they've exposed their animals to. And don't buy someone else's problem. A lot of times, I can't believe, this animal I got a really good deal. It was really cheap. Well, there may have been something going on that you didn't know about. We also have to remember that pre-patent period or the incubation period, which is a time when an animal may be exposed, but it's not showing any symptoms yet. So if we bring the animal home and we put it directly into the pasture with our animals and it gets sick a few days later, then we're too late. We've already exposed our animals. This is why quarantine is very important. And then you can also test for diseases while they're in quarantine. Bring the new animal in. Let's say it's a goat, and you can pull a blood sample and test it for CAE before dumping it out with the other animals. There are some things that can't be tested for, though, such as foot rot. Foot rot can be really contagious. If you've never had it on your farm and you bring in an animal that may not even be showing symptoms at the time, you can have massive outbreaks. So let's talk a little bit about quarantine areas. We know we're putting the new animal in there for at least 2 weeks, but this 6 feet rule, if the animals are going to be 6 feet away from each other, that's going to require 2 fences. Animals are curious. So whenever you bring in something new, if there's only 1 fence between them, everybody's got to run up and investigate, introduce themselves to the new animals. So if we're going to keep them 6 feet apart, that's going to take at least 2 fences. And as we're deciding which area we're going to designate as our quarantine area, remember your working facilities. Do you want to put your quarantine area, your dirty area, somewhere close to the chute where if you've got to work your other animals, they've got to walk right by them? Avoid driving trucks and tractors through your quarantine area, right? So if we go into the quarantine pen with our vehicle and then drive that same truck into the other fields, we may still be spreading the pathogen. Avoid water runoff. Don't put your quarantine pen on top of a hill where when it rains, all the water and the manure are going to run straight into the clean fields. And while they're in this quarantine area, make sure you test and vaccinate. And then something that a lot of us don't think about is the flow of movement. And this is the order in which you're going to feed, the order in which you're going to check animals every day, right? So the animals that are most vulnerable need to be the first ones that you look at. So usually this is our young animals, right? Then after that, go and feed your weanlings and your breeding stock. And then sick or quarantine animals should be fed last. We've all had those animals that were sick, right? And we tossed and turned all night, just hoping they were going to be better in the morning. Well, in the morning when you go to feed, that still needs to be the last animal you touch because it has an issue. So you don't want to touch the sick animal or feed it, walk through its pen, and then immediately go feed your young animals. So it's the order that we treat or feed in every day. And paying attention to details. Sometimes it's things that we don't think about. For instance, water buckets, right? So when an animal is drinking out of a water bucket, it commonly will slobber or get some kind of respiratory droplets into the bucket. If you're filling up water buckets and you stick the hose in that bucket that's contaminated, every bucket that you stick the hose in after that, you're also going to be contaminating. So you can spread it just with the water hose. As I mentioned earlier, cell phones have tons and tons of bacteria on them just because they're not easy to sanitize and we take them everywhere we go. We wash our hands, but we can't wash our cell phone. When you have an animal that's sick, the first thing you need to do is to separate it. Hopefully it hasn't transmitted anything yet, and then that's optimal, but we need to get it out of the pen because it's got everybody else in that group at risk. And don't get in a hurry. Most of the time when we have breaks in procedures, it's just because we got in a hurry and we tried to take a shortcut. But when we start talking about transmitting diseases, a lot of times these shortcuts can cost us more in the long run. So farm to farm travel, I said limit guests, but occasionally you will have, you know, an aunt or uncle or a friend that wants to come to your farm. Ask your guests to wear boot covers. There's disposable boot covers that are very, very inexpensive that you can ask them to wear when they're on the farm. And when you explain to them that, you know, you just don't want to bring any problems in that you've never had, most people understand that. Limit your travel to other farms or stockyards. If you do travel to other farms or stockyards, have a different pair of boots that you wear. Foot baths with disinfectant at locations wherever you enter the farm. Have a foot bath. There's several different chemicals. Bleach is, you know, an easy one, just a dilute bleach solution that you can step in just in case you have anything on your boots. Equipment, whenever possible, separate equipment for separate locations. Right? So if you have multiple farms, you can easily buy hoof trimmers for each farm. That will decrease some of the spread. Wheel wells of trucks or side-by-sides accumulate a lot of mud. So every puddle that you went through, all the mud that collects around the wheels, that can be a source of contamination. Don't park your vehicles in areas of water runoff. If you have an area where water runs off or manure and you park your truck right in the middle of it, everywhere you go for the rest of the day, you can spread that pathogen. And even have totes where in your truck that are clean versus dirty. Take your coveralls off and then put them into a specific container in that truck. So you're not getting any pathogens, virus, bacteria on the seats, on the steering wheel, or anywhere in that truck where you may spread it the next time you go somewhere. And I do want to make a distinction here, the difference between cleaning and disinfecting. Designate an area for decontamination, right? So this is the area where you're going to put your foot bath. This is where the clean area is after it's been sanitized, and this is where it goes before, right? Just like we would do with our laundry. You know, there's dirty clothes in the hamper and then clean clothes go in the closet. Cleaning is the removal of debris and organic matter. So if your boots have a lot of mud, right, the first step is cleaning. You need to wash off all of the mud, any organic material. Right. Now, disinfecting is using chemicals to kill pathogens, such as bleach. If you have a really muddy boot and you step in a foot bath with bleach in it, well, bleach will sanitize the outside of that mud, but it can't get to the actual surface area of the boot if it can't touch it. Contact time, right? Stand there for a minute and give the disinfecting agent time to work. Another form of cleaning that we really don't think about, but when we talked about chronic carriers, animals that look healthy, but they're carrying diseases, they become a risk to all the healthy animals in the herd, right? They serve as a reservoir. So part of cleaning is identifying which animals are the chronic carriers and removing them from the herd. And lastly, I do want to talk about zoonotic diseases. This is protecting ourselves. I mentioned sore mouth, but also a lot of the reproductive diseases. Whenever you're treating something that's sick, always wear gloves. Even if you wore gloves, wash your hands afterwards. Wash your boots. You know, when you go to take off your boots, wash your hands again. A lot of the reproductive diseases in sheep and goats that cause dystocia may actually cause pregnant women to have miscarriages, especially if, you know, you were a pregnant woman. Always, always, always wear gloves if you're dealing with a dystocia or a ewe or doe that's having an abortion. And then avoid eating or drinking in working areas. You know, these things are, you know, kind of common sense, but a lot of times when we get in a hurry, we forget about it. All right. If you have any questions about forming a biosecurity plan or risk factors for your farm, feel free to contact me at Kentucky State University. My email is jerusha.lay@kysu.edu, or phone number is 502-597-6672. Thank you.